more hopeful note, the Appropriations Committee, thanks to the work of Senator Murray and Senator Blunt last year, recommended a $2 billion increase in National Institutes of Health funding, which was approved. They've recommended a second one, which if we do our jobs properly, we might be able to approve by the end of this month, April. And the 21st Century Cures legislation added another $5 billion. So that's the path that many of us hope that we will be able to follow for the National Institutes of Health. Let me get down to some brass tacks here. Senator Murray observed, and I observed, and you've observed that typically this is a bipartisan proceeding. There's been an enormous amount of work gone into this, many briefings going back to 2015, a lot of good faith negotiation discussion. You've done your job on time. Now it's up to us to do our job on time. On time means, for example, and this isn't set yet, but if we were to finish our work in committee in April, which is this month, and take it to the floor of the Senate next month, which is May, that would leave time for the House to act and for there to be a conference, if necessary, by the end of July. We have to finish by the end of July in order to avoid expiration of the agreements in October 1. In other words, we have to finish before our work period, our home work period begins in August. What would be the consequences from your point of view? We heard it last week from FDA, but what would be the consequences from your point of view if Congress fails to act by the end of July to reauthorize these agreements? Let's start with you, Ms. Holcomb.
I think this would be, it would be awful. And the reason—
Well, in what way?
The reason is that there is a kind of moment in time, according to government personnel rules, where if FDA does not see that this reauthorization is moving forward and predictably will be achieved by the end of September, they will have to notify their staff that their jobs may be in jeopardy.
Would you assume that moment would be reached by if Congress hasn't acted by August the 1st?
Yes. I'm assuming that it is sometime in that time frame, yes.
Mr. Goff?
It would be devastating to the generic industry if this was not to pass.
In what way?
If you go back to appropriations, and Senator Warren made that comment, in the generic industry, appropriations pay for about 320 FTEs at the agency to work on generic drugs. The user fees that we put in place will increase that by about 1,500 FTEs, taking the total up to about 1,830 FTEs. That's what we believe is needed to get the approvals at the level that we need them and to get the backlog reduced, number one, and to start hitting that 10 and 8 month metric.
Would you agree the end of July sounds like the point before which we have to finish our work?
Yes, Dr. Woodcock has already stated that at the end of July, 1st of August, if it's not passed, she'll have to start working on that furloughing process, whatever that might be.
Mr. Whitaker?
We have the same concerns, and I think the timeline you outlined is right. I think I would associate myself with the remarks of Dr. Schuren. If he suggests a third of the workforce would be lost, that's a huge hit to our industry. And I think broadly it creates tremendous uncertainty for our industry, and in many ways uncertainty is really the enemy of innovation. And when you get hit with that uncertainty, it freezes companies. And so we would want to move as quickly as we can. I think the timeline you've outlined is right.
Ms. Benz, from a patient's point of view.
I would say that the impact is probably going to happen sooner than the summer because we tend to focus on the morale of employees at the agency, which is something I think is not always talked about. These are really dedicated federal employees, and when we interact with them, they just want to do their job to keep people safe and to get drugs to market that are going to benefit them. And when they hear that their jobs are in jeopardy and potentially at risk, it makes anyone's position feel almost inadequate. And so I would just continue the momentum as quickly as you can, because I think it's going to be beneficial to not just the direct impact that user fees are going to have, but also to keep morale high.
Thank you, Ms. Benz. Senator Kane.
Thank you, Mr. Chair. And I want to echo